Good evening, one and all. I am Karan Sharma, and on behalf of FTC, the makers of Vitcofall, I welcome you all to the 16th and the final episode of our Sunday 9 p.m. show, Iron Talks. Last week on Iron Talks, we discussed that anemia could be a part of or could hiddenly lead to a vicious cycle of undernutrition, leading to anemia, leading to loss of appetite, leading to anemia again, and so on goes on this vicious cycle. Having said that, one of the major issues that lie with a patient of anemia is undiagnosis. Furthermore, to this, even if a clinician diagnoses anemia, but the patient compliance is still a big question mark across India when it comes to managing anemia. All these factors make our topic for tonight, that is medication counseling in anemia care, all the very more important. So before we have our speaker amongst us, let me call upon stage our host for tonight, Dr. Sanjay Kalra. Dr. Sanjay Kalra is a DM endocrinologist who has done his DM endocrinology from the prestigious IIMS Institute, New Delhi. Along with that, Dr. Sanjay Kalra not just has many prestigious awards and accolades to his name, but also has been a panel member for many authoritative studies and also has been a chairperson for many key medical and doctor associations for the welfare of humankind. Sir, on behalf of all our audience present here tonight, I welcome you on stage. How are you doing this evening, sir?
Perfect, Karan. It's become cold here now, so it's chilly in the air, but there's warmth
Right.
because there is this World Cup final match going on today, and I'm
Yes, sir.
sure all our listeners will, be doing two things at one time, multitasking: the football match score and also the Iron Talks.
Right, sir. So, sir, who do you predict is going to win the match today?
Good question. Let's hold our horses. But in the meantime, let's just take a recap of what has happened so far. Argentina is leading 1-0. France is at 0. So let's see what happens.
Right, sir. Right, sir.
It's been a beautiful journey. The last 4 months, we've been talking about iron. We've been talking about various aspects of iron: clinical, pharmacological, nutritional. We've explored gynae, pediatrics, geriatric medicine. We've talked about different diseases: diabetes, metabolic syndrome, gastroenterology, cancer. And we've also focused last week on diet. In each and every program, we've talked about therapy, of course. But today we are going to focus on treatment. When we look at treatment of anemia, the first thing is to find the reason for anemia. Now, most often there will be nutritional anemia in the country, and most often the nutritional anemia will be because of iron deficiency. So, roughly two-thirds of our women, one half of our children, and one-third of our men will be iron deficient. So, how do we treat? Of course, we will advise lifestyle measures. We will give anti-helminthics, anti-protozoals if needed. We will ensure a healthy diet. The diet should have iron rich foods, number one. Number two, it should have foods which facilitate iron absorption, like vitamin C, for example. And not only that, it should have minimal use of drugs or foodstuffs which, which reduce iron absorption, especially when given along with an iron tablet. Example would be antacids, proton pump inhibitors, H2 receptor blockers, calcium, zinc, magnesium, other multivitamins. Even some antibiotics like quinolones, they can also reduce iron absorption. So we should try to make sure that these kind of drugs are not given along with iron. If you wish to give calcium and iron, for example, give them at antipodal meals, one in the morning, one at night. So that is one thing. What would you want to add to an iron tablet to improve facilitation, to improve absorption, to facilitate absorption? Vitamin C is a good idea. Acidic foods like tomatoes are good ideas. But this is all about lifestyle modification. Apart from this, we do need therapy. And it's a matter of great pleasure to introduce Dr. Abhijit, our expert speaker for today. Warm welcome, Dr. Abhijit Kumar.
Thank you, sir.
And Abhijit, the entire nation wants to know what is your prediction? Who's going to win the match today? Is it Argentina or France?
I hope, sir, Messi must must. I hope this is last final for Messi. So I hope Argentina must win.
Okay, so and so far they are leading 1-0. So
Thank
maybe Dr. Abhijit's prediction will hold true. So now, since the entire nation has got to know what Dr. Abhijit thinks, the second question for Dr. Abhijit is, uh, Dr. Abhijit, do you think we will ever be able to eradicate iron deficiency anemia?
Definitely, sir. Definitely, India in 21st century is going to be the most developed country because we are not focusing only on economic aspects. Rather, we emphasize on ethics and societal upliftment of lower socio-economic strata. And this is a welfare state. And definitely, given the vision, the government and private sector, the way they are contributing, definitely we are going to achieve the milestone.
This is really optimistic. Very happy to hear this. And in one sentence, Dr. Abhijit has encapsulated so much of what our great country is all about. We'd like Dr. Abhijit to continue with the discussion. Our topic for today is medication, and today is a fitting finale, just like the World Cup final.
Yes,
Today is a fitting finale to 16 weeks of Iron Talks. So, Dr. Abhijit, the
yes, sir.
floor is yours.
First of all, sir, thank you so much. I thank Dr. Honorable Dr. Sanjay Kalra, sir, for introducing me and giving me opportunity to speak on this platform. And I would like to thank FDC for conducting so nice initiative. Now, given the topic is medication counseling in anemia care. So first thing I would like to highlight that medication counseling is not a legal foundation for any doctor. We are not legally bound to provide medication counseling. Nothing is there that any law is there which is bounding us. But medication counseling is ethical foundation, and it is ethical duty of doctor to counsel their patients, because without counseling, almost any patient we are going to lose the touch. Because what is there, this is a long term therapy, anemia prophylaxis. Some of the basic drugs like iron tablets is there, or protein supplements is there, so we need to continue it for minimum 6 months or a year depending on the condition of patients. But if patient is not properly counseled, ultimately within a week, within 15 days, or within a month, it is much expected that patients stop medications. We are facing this scenario, and since last 10 years of my medical practice, I am seeing this is happening quite often. Now, medication counseling becomes the foundation stone in treatment in a society where there is mistrust. At present, there is so much negative media campaigns, social media campaigns against the doctors. Further, there are many self-proclaimed experts who comes on national media platform, electronic media, print media, and says anything. We have seen such scenario during the time of COVID-19 pandemic, where some of them, uh, I don't want to name them, but they have taken the title doctor, whatever their name is, and openly they were coming and they were saying that mask has no role in COVID prevention. So such people, this scenario has led to large number of deaths, as we have seen in COVID-19 pandemic second wave. I have seen the scenario much closer because I was the COVID-19 uh, COVID medical officer in Dhanbad. So the idea is that why medical counseling is necessary and what are the hurdles in this. As you all can see the PPT which has been prepared. So the PPT is prepared has been it is in a very basic form. So I'm not going to repeat what is there in PPT, because as you all can read, and it is very easy and it is in very easier terms. So it is not required at all for me to repeat the PPT. So I will be sharing the ideas which is not there in the PPT. So what is happening that there is severe burden on health infrastructure. Like almost we are having 70 to 100 patients in OPD, and the time frame is 3 to 4 hours. And what we are seeing that if we are going to counsel each and every patient, so minimum if it will take 5 minutes also, then it is going to be 500 minutes. So it is nearly about 8 to 9 hours task. So in this, I would like to really thanks again Dr. Kalra sir and the FDC that such seminars and such iron talks is going to be the game changer for medication counseling. Because if this video or these videos on this platform will reach to the patients or public or citizens of our country, then they would realize what is medication, why the prophylaxis is necessary, what is the role of medication. So now I will just like to highlight some of the data that how there is severe burden and how it is impeding the medication counseling. 70% of our population of India are residing in rural areas, and the population of doctors catering to rural areas is only 15 to 20%. While 30% of our population are residing in urban areas, doctor catering to urban areas, the population is 75 to 80%. So there is a huge mismatch when compared to urban versus rural areas. Further, you all will be shocked to know that government of India expenditure on health is only 1.3% of its GDP. The economic survey has recommended minimum at least 3% of GDP to be expended on uh, health. But the problem, what means the government hurdle is there, as is that health is a state subject. Means in our constitution, there are three things: union list is there, state list is there, and concurrent list is there. So state, as our country is having a federal structure, so health is primary concern of state governments. But you will be again shocked to know that even the state governments, the maximum expenditure of its GDP is by Himachal Pradesh on health, and it is also just 1.7% of GDP on health. So 15th Finance Commission has set up a high level group in which there are some of the eminent doctors. I would like to name them. Dr. Randeep Guleria sir, who was director of AIMS, then Dr. Naresh Trehan sir, and then Dr. Narayan Sethi sir. So these three were members in high level group. Some of other doctors were also there. So they recommended to transfer the subject of health from state list to concurrent list, so that if government of India, central government makes any rules, it is likely to be bounded by the state government, so that we should be having a pan India a setup like that. A rule can be formed of about the medical ethics, some guidelines, the medication counseling. So this must be integral part in the treatment module. So I wish that this must be done, and in near future, we will be having a good setup and good framework, which will be followed by all the doctors and the all my senior colleagues also. Then now, what is the requirement for medication counseling? As I will just say a statement made by Honorable Nitin Gadkari sir, who is Central Minister. So he said that credibility is the biggest capital in 21st century. And all my senior colleagues, all my fellow mates, they must be knowing that yes, credibility is the biggest capital, because whatever we are prescribing to patients, whatever investigations we are writing, whatever treatment we are writing, if a doctor's credibility is at stake, then patients is not going to follow them. So lot of medical ethics, lot of morality is required to make yourself so much competent ethically and morally that whatever you are saying is likely to be followed by millions. Like for example, I would just like to name and thanks and give honor to late Dr. K.K. Agarwal sir. His short videos were so much famous at the time of COVID-19 pandemic. It has helped millions and millions of people to just go through those 2, 3, 5 minutes videos or 30-minute session and to change their lifestyle regarding COVID-19 pandemic also, sanitation and hygiene, regarding diabetes also, hypertension also, how to modify your lifestyle so that you can lead a healthy life. Now, again, why medication counseling? Why not we are forcing the patients, or why not we are telling the patients for dietary supplements? So I would like to highlight some of the point. Rice is our staple diet, and it is very much inferior in compared to terms of micronutrients or in terms of protein intake. Now, hemoglobin, which is essential part of anemia, the entire idea is so that hemoglobin should rise. So it requires two components, Fe, that is iron, and second thing is protein. Both iron and protein mix up and constitutes hemoglobin. So our staple diet, which entire India, much of the India, uh, particularly I am residing in Jharkhand. So Jharkhand, West Bengal, Odisha, Bihar, particularly these areas, even Andhra Pradesh, Odisha, these states, or even southern states, Tamil Nadu, Kerala, and all, rice is the most staple diet, and it is nutritionally deficient in both the things, iron also and protein also. Then why not dietary supplements? Why not to add pomegranate, जैसे अनार हो गया, या several other fruits and all. Now you will be shocked that only rich people are able to afford fruits like pomegranate, because it is costing almost 500 to 600 rupees per kg. And then to process it, उसका फिर जूस बनाना है, उसको रॉ खाना है, उसके बारे में किस तरह से अप्रोच करना है, it is very much debatable कि how to improve through dietary health and कितना खाना है, what is the quantity to take, and further उसमें compliance होगा कि नहीं. It is possible for a person to have that much quantity which is giving the adequate amount of iron. In comparison to vice versa, price comparison, the medication cost just only between rupees 1 rupees to rupees 8. It is a bracket. So price comparison, the medication is much cheaper. Further, the compliance is much better, because at times the India is having all the four seasons: summer, winter, rainy, spring. And as you know that during winter season, हमारे यहाँ कहा जाता है कि सर्दी में जूस नहीं पीना चाहिए, because it leads to cough and cold. Further, जिस आदमी को खांसी वगैरह है, सर्दी है, उनको भी जूस अवॉइड करने को कहा जाता है. ऐसा भी नहीं है कि उसको जूस को गर्म करके दिया जा सकता है. In such and such scenario also, medication is the best form of treatment. So prophylaxis is uh, adequate iron prophylaxis. Now, what is the leading cause of menstruation, and particularly in India? So one is dietary deficiency. Second thing is that almost more than 70% of females are suffering from anemia, are anemic. One single reason is physiological reason, the monthly menstrual cycle, which leads to loss of blood. And there is a social taboo about menstruation. People generally don't talk about menstruation. Even doctors also at times hesitate to speak to patients about their menstruation. Even if the patient is coming to medicine OPD for certain things, particularly I want to highlight means my approach. If I feel that patient is having breathing difficulty, having hypotension, having weakness, certainly I ask from patient about her menstrual cycle, that whether she is suffering from menorrhagia, whether there is increased blood loss, whether there is pain is associated, dysmenorrhea is there or not. And certainly then my approach is to correct her anemia along with the associated menstrual complications. Then Government of India role also I am liking to highlight, like a school health program is there where iron prophylaxis has been made mandatory. So this is a very laudable effort by government of India to eradicate anemia. And as sir has said that whether we will be able to achieve it or not. So certainly if different sectors of society comes together, like non-government organization, government, private sectors, reputed pharmaceuticals company like FDC, noble doctors who will come willingly to give a hand forward to public and citizens of India to make them aware about the disease, to make them know how to approach the disease, to make them know that please don't go by the negative social media campaigns or negative media campaigns. And till now, and I think that till the humanity will exist, doctor profession is very noble, and maximum of the doctors, apart from few, maximum of doctors only think about the welfare of people, welfare of their patients. Now, some of the approach again I would like to highlight that while treating anemia or while the prophylaxis, we must see the patient's socioeconomic background. In spite of writing costly investigation, not costly investigation, also basic investigation like CBC. CBC is costing almost 300 to 400 rupees. We must avoid CBC if patient is not suffering from any infection, any fever or anything else. If we are suspecting anemia, first of all, we must rely on our clinical approach. We must look for pallor. If sign is present, if we are seeing the pallor is there present in patient, we must start the prophylaxis iron therapy after counseling the patient directly without writing any investigation. Suppose if investigation is required, patient is suspicious about his blood reports or hemoglobin parameters, then we must write only hemoglobin investigation, which is costing almost only rupees 40 or 50 rupees. This helps to gain the trust of patient. Again, credibility and trust is the cornerstone of treatment for treatment. And then we must emphasize not only on iron prophylaxis, simultaneously we must emphasize on the protein supplements also. We could advise the patient if he is willing to take non-veg foods, eggs we must include in their diets because egg is rich source for protein. And then suppose if patient is vegetarian, because in India a large number of population are vegetarian, so we must promote pulses. And then again the cost factor is there, pulses is costly. So government of India is focusing to promote millets, and millets is extremely nutritious food. Even in 2018 or 19, it was declared as international year for millets, like puttu and kuttu, something like that. It is in every regional state like Karnataka, ragi, and like this. So these are very nutritious food, rich in iron, rich in protein. So it must be promoted. Millets must be promoted, should be included in diet and dietary habits. And then last but not the least, try to include the combination of tranexamic acid plus mefenamic acid so that to reduce the blood loss for those females who are suffering from menorrhagia, and there is increased blood loss in that. So if such medicines will be included for 4 to 5 days during the menstrual cycle, then while we will be having the iron intake and protein intake, which will help to increase the hemoglobin. And further, we will be decreasing the blood loss simultaneously. So this will help to uh, a better improvement in the patient's health. Because what is there that what I have seen that a good medication therapy, hemoglobin increases somewhat between 1.5 to 2%. At times it increases to 3% also per month. But just after menstruation, there is again dip of 1 to 2% of hemoglobin. So we must control both the things simultaneously. Then a message to the society that Indian society is very much culturally attached with gold. अमीर हो या गरीब, गरीब से गरीब, घर में छोटा सा छोटा या थोड़ा सा सोना वो रखना ही रखना चाहते हैं. दे आर वेरी मच अटैच. लेकिन मैं फिर से कहूँगा, हेल्थ इज वेल्थ. आप जितना गोल्ड से अटैच हैं, उससे ज़्यादा अटैच आपको आयरन से होना होगा, लोहा से होना होगा. You must make it part of your culture. If you want to gift to your wife, to your sister, try to gift iron tablets in spite of gifting gold chain, अंगूठी, लॉकेट. ये सब देने से अच्छा है आप उनको आयरन टैबलेट्स गिफ्ट करिए. एंड I would like to conclude my talk. And again, I would like to thank FDC, the entire team, for conducting such a nice and noble initiative, Iron Talk. Again, I would like to thank our Honorable Dr. Sanjay Kalra sir, who is leading this platform so beautifully after our late Dr. KK Agarwal sir. And thank you all. Thanks.
Thank you, Dr. Abhijit. Great presentation and very lucid talk. Uh, the strength of this talk was its simplicity, and I'm sure everyone will agree with us. And Dr. Abhijit, while you were speaking, Argentina has scored its second goal. So now it's 2-0.
Thank you, sir.
So Dr. Abhijit's Bhavishwani seems to be coming true. Now I'm thinking if I had requested Dr. Abhijit for a couple of things more, he would have done that as well. Today seems to be a lucky day.
Thank you. Thank you so
So
much, sir.
Dr. Abhijit has requested for a particular team to win in the World Cup. But more important, he has requested for all of us to work hard to counsel our patients properly and to make India anemia free, to eradicate iron deficiency anemia from India. And I'm sure we'll all work together to achieve this aim of Dr. Abhijit's, to accomplish it. Uh, Dr. Abhijit, many questions and comments coming in for you. Greetings from Dr. Monu Gurung. Apart from that, there is a question on diabetes and tuberculosis. Patient is on ATT, appetite is good, on insulin and OADs. Okay, and of course we will adjust the insulin and the OAD dose. But they are asking about diet. Should we give more calories? The answer is yes. Do not starve this particular patient because already the patient is in catabolic state. Patient has tuberculosis, and small frequent meals would be the right way ahead. So what Dr. Vinay Desai is saying is right. And Dr. Abhijit, Dr. Vinay Desai welcomes you to future programs, and he says, uh, would you be interested in speaking about diet and calorie counting?
Definitely, sir. Any work, any topic given by such respected seniors, I would definitely like to be part of this campaign. And whatever a small contribution I could make to this platform, it will be means means I'll be highly obliged for this.
Sure. Dr. Sanjay Shehora raises a few queries for you. Let's take them one by one. Sir, long-term iron supplementation, can there be any side effects?
Definitely, side effects is not for iron supplementation only. Side effect is for long term for any diet also. If you are on a non-veg diet for long term, it is going to lead chronic constipation. Similarly, iron therapy for long term, it is going to cause GI upset, going to cause constipation. But we must compare the benefits versus the complication. So while looking for the benefits, we will be shocked to know that it is highly beneficial in terms of side effects. As you all can see, the world has seen the COVID-19 pandemic. You compare the data. The patients who were having high hemoglobin count, good RBC, they soon out come from that COVID affected patients. But the patients who were anemic, they were more prone for morbidity and death. So yes, sir, there will be a small or minimal complication, but the benefits will be advantage. Means it will be only upper side.
The risk-benefit ratio is always beneficial. There is more benefit than risk. Dr. Sanjay asks another question. Long-term protein supplementation, long-term multivitamin supplementation. Can there be side effects of this? Have you seen any side effects in your clinic?
Uh, Sir, particularly saying that protein supplementation, when we are giving, we must see what is the condition of the patient. At least the renal profile must be adequate. Suppose if renal profile is not good, I don't suggest directly means protein supplements in raw form. Rather, I would suggest protein supplements in dietary form. If we are giving protein supplements in dietary forms like eggs, pulses, millets, 100% it has no side effects, no side effects in any renal patients in whatever the stage of CKD will be there. No side effects in that. But yes, in if we are giving raw protein, powdered protein, a supplements, a medical supplements, then we must see the renal profile. And if it is renal means it is adequate, GFR is adequate, we must go ahead. If EGFR is in abnormal range, we must taper the dose, and we must monitor it monthly. And given the supplements, given the bracket of anemic patients, most of the patients, apart from few, most of the patients you will be see young, in her reproductive age group, childbearing age group. So in that scenario, and they are very much means malnourished, very much malnourished. And in terms of, again I am saying, if compared to dietary supplements with medical supplements, please do compare the price. If I'm going to advise the patient for pomegranate, it is not possible for a person to buy it. It is costing rupees 600, but it is possible for a person to buy rupees 1 or rupees 2 rupees tablet. Similarly, in protein also, if I am going to advise her to have pulses in that much quantity, as you know, the inflation and the government, महंगाई जो है 200 रुपए किलो की दाल हो गई है. बट इन कंपेयर टू एक छोटा डब्बा भी आ जाता है अराउंड 150-200 में प्रोटीन का, having 1 teaspoon with milk or with water. So he will get the adequate amount of protein, and just we need to monitor depending on the condition of patient to taper it, because this is the idea. Thank you.
Very well said, Dr. Abhijit. And we see a lot of wisdom in Dr. Abhijit's simple words. And exactly the same things are echoed by Dr. Vinay Desai and Dr. Anand Purandare. The social angle of medicine and I think the humane angle, Dr. Anand, if you will agree with me, that is something that Dr. Abhijit seems to not only preach about, but also seems to be practicing. And it is easy to make out who is practicing what. So we get that very good feeling, very good vibes from Dr. Abhijit. Dr. Abhijit, greetings to you from Haryana as well, from my state. And Sunny Grover Sahab says greetings and says thank you. You've been talking about iron supplementation, but Mr. Grover asks, what about vitamin B12? Is vitamin B12 deficiency common in India?
Definitely, sir. Vitamin B12, cyanocobalamin. Now, what I will say, it will be shocking. Cyanocobalamin, vitamin B12, only dietary source is non-veg foods. वेजिटेरियन फूड में B12 होती ही नहीं है, साइनोकोबालामिन होती ही नहीं है. 70-80% भारत की जनता वेजिटेरियन है, जो खाना भी चाहते हैं उसके कॉस्ट के कारण खा नहीं सकते हैं. एंड विटामिन B12, मेगलोब्लास्टिक एनीमिया, पर्नीसियस एनीमिया काफी कॉमन है, बिकॉज 70-80% जब देश की जनता नॉनवेज फूड खाती ही नहीं है, आप उसको खिला भी नहीं सकते हैं, रिलीजन का एंगल आ जाएगा. आप बोलने जाइएगा, आप डॉक्टर हो, रेप्यूटेड हो, वी नीड टू सी कि इन अ सोसाइटी वेयर वी आर लिविंग, अपार्ट फ्रॉम डॉक्टर का कोई रिलीजन नहीं होता है, मेरा ये मानना है, बट पेशेंट का रिलीजन होता है. यू हैव टू रिस्पेक्ट हिज और हर सेंटिमेंट्स. सो इट्स बेटर टू गिव देम सप्लीमेंट्स फॉर विटामिन B12. दैट इज मच ईजियर, क्योंकि आप उनको नॉनवेज फूड खाने को कह नहीं सकते हैं. इट्स बेटर कि विटामिन B12 सप्लीमेंट्स दें. एंड इट इज, यस सर, इट इज वेरी मच कॉमन विटामिन B12 deficiency in India.
So thank you, Sunny, for raising this point, and thanks, Dr. Abhijit, for answering it in such an emphatic manner. And if your patient is vegetarian or vegan, and patient may say I am non-veg, but then what is the definition of non-veg? One tiny piece of chicken once a week or once a fortnight, or maybe once a month. That will not classify as non-vegetarian from a nutritional point of view. So you have to supplement with vitamin B12. And some people may have only neurological manifestations, others may have only hematological, like megaloblastic anemia, and others may have both. So keep an open eye. Greetings to you also from Karnataka, where Dr. Gauri Shankar Dharmaraj is based. And he says, sir, for persons with diabetes, specifically for those with diabetes, what are the iron rich foods that we can advise?
रागी इज बेस्ट सर. एज यू आर फ्रॉम कर्नाटका, कर्नाटक का रागी और जो आप लोगों की एक रोटी होती है सर, काफी सख्त होती है, क्योंकि वो जो टेम्परेचर होता है वहाँ का, ग्रामीण इलाके का, कर्नाटका का, इन रूरल एरियाज, रागी की रोटी होती है, एंड दैट इज अ वेरी रिच सोर्स फॉर आयरन. और रागी को खाने से डायबिटिक में कोई दिक्कत नहीं है. इवन मिलेट्स इज बाउंड टू प्रोवाइडेड फॉर डायबिटिक पेशेंट्स. मिलेट्स का जो रोल है, सो इंडिया इज सो मच कल्चरली रिच कि हमें किसी वेस्टर्न कंट्री, किसी यूरोपियन कंट्री, किसी को नहीं देखना है. जस्ट वी नीड टू लुक बैक, गो टू आवर ट्रेडिशंस, गो टू आवर होम, अपने ग्रैंड मदर के पास बैठिए, उनसे पूछिए वो लोग क्या खाते थे, आपको जवाब मिल जाएगा.
Yeah.
हमारे घर में ही उसको पकाया जाता है, खिलाया जाता है. थैंक यू.
And Dr. Gauri Shankar, you might be able to help us because I have forgotten the name. I remember the word pesarattu. Pesarattu is not a dosa. It is an alternative for dosa, which is made out of pulses. So this is, I think, from Telugu cuisine, something we should encourage. But my friends in Andhra Pradesh tell me that there is a Kannada recipe for multi-grain dosa. 8 kinds of grains are put together to make that dosa, and they advise their patients in Andhra Pradesh and in Telangana to follow the Kannada recipe. But I've forgotten the name for it. If Dr. Dharmaraj or anybody can point out, that would help everyone, all of us across the country. Multi-grain dosa with 8 different grains in it. That is higher in protein and in iron. Dr. Shashi Khare asked a question: can we eat curd with meals because curd contains calcium and it may hamper the absorption of iron?
Curd could be included, and means curd should be included. I don't think that in even in diabetes patients also, curd in limited quantity it can be included in the diet. Only problem lies with the curd is while you are suffering from cold and cough and during the time of season. As I have said that India is a diverse country, 4 seasons are there. Our diet changes with the seasons, so only at that time it cannot be taken. So that's why I said that medication rule should be means all the 12 months, and then simultaneously we must include the diet depending on the season. That is there.
And one last question from Dr. Dharmaraj. Uh, Dose of vitamin B12. So normally, Dr. Abhijit, what dose do you use in your practice? And then do you have a
Sir,
specific dose for those with metformin-induced B12 deficiency?
sir, to be very frank, means I am what I am seeing there, sir. The patients are from very much low socioeconomic strata, so it is not possible for me to get the vitamin B12 label to be done in pathology and to monitor the dose, and depending on that condition, or even if I'm prescribing metformin to monitor that what is the less. But I hope 1500 mcg daily, that is adequate, that is more than enough, I hope so. Because in terms also means in long therapy for a month, 2 months, 3 months, individually it is going to raise the vitamin B12 level. So there is nothing much means nothing much to worry about, that we will be skipping something. Rather, we will be helping the patient in terms of saving their money also, because the pathological investigation is very much costly for vitamin B12 levels, and the medicine is very much cheaper in terms of price wise. So my idea of treatment is to prescribe the dose which I have said, and I have seen that means जैसे पेशेंट्स कंप्लेन करके आएगा कि टिंगलिंग सेंसेशन होता है पैर में, झिनझिनाहट होता है, नमनेस होता है. ऐसे पेशेंट्स को, ऐसे डायबिटिक पेशेंट्स को जब हम लोग स्टार्ट करते हैं विटामिन B12, तो डेफिनेट इम्प्रूवमेंट होता है. एंड देन क्लिनिकल इम्प्रूवमेंट पे ही हम लोग ट्रीटमेंट को मॉनिटर कर लेते हैं, रादर देन गोइंग फॉर पैथोलॉजिकल इन्वेस्टिगेशन.
And another way, Dr. Gauri Shankar, you can do is you can give sublingual vitamin B12. So if you add one tablet a day, even if it is economical, patient will say you have increased my pill burden. So maybe like one vitamin B12 sublingual tablet, maybe once a week for the first few weeks, and then once a month you tell the patient to keep on taking. There's another question, let me take briefly, and that is about how to diagnose B12 deficiency. Basically, neurological and hematological. That is the general concept. If patient comes with neuropathy, positive or negative symptoms, patient may or may not be diabetic. A diabetic patient doesn't necessarily have to have uh, diabetic neuropathy. It can still be a nutritional neuropathy. And in India, even in diabetes, I think nutritional neuropathy will be more common than diabetic neuropathy. And then there is nothing to prevent the patient from having both. So before you begin doing other treatments, we should do nutritional optimization and glycemic optimization. We can also give injection of vitamin B12, like Dr. Nitin Narula asks, but usually it is limited to pernicious anemia. And in the West, injections are supposed to be a kind of trauma, a kind of violence against the patient. Why will you give an injection if oral is available and if oral is absorbed? If oral cannot be absorbed, think sublingual. And if sublingual is also not absorbed, only then will you think of injectable. So that would be a general rule. Sir, one question from your home state, Dr. Abhijit, from Jharkhand. And Madam Manjula Rani Saha, Dr. Saha says, various types of green leafy vegetables are available in Jharkhand. Do we encourage the use of these vegetables to correct iron deficiency, protein deficiency, and vitamin B12 deficiency? So, three questions for you.
Definitely, ma'am. We do promote such green vegetables, but protein intake it won't help much. But in definitely in iron prophylaxis and vitamin B12 prophylaxis, it is going to help. But again, I am saying that it is a very diverse country. Even in a district, also so much diversity is there. And then food habits and food choice. Indians, irrespective of socio-economic strata, they are very choosy about food. So again, I am saying that we have to promote the food, we have to promote the dietary supplements, but side by side, we must counsel them for medication therapy, for prophylaxis therapy, side by side, because it is very much easier. Compliance rate is very high, and the other demerit is there. Such green leafy vegetables are not available throughout the year. Those vegetables are available particularly in a season, either during the rainy time or either during winter or summer, but not throughout the year. So definitely, ma'am, means side by side we must promote them, and we do promote it, like beetroots and all.
Enjoy the colors because they actually contribute to a lot of minerals and vitamins. And they will not add too much of protein, but still, dietary diversity is something that is important. You should have a diverse plate, not limit yourself to the same foodstuffs again and again. Sublingual, Nitinji, means below the tongue. So you have these paper tablets. You will get methylcobalamin paper tablet. One name is Quickobal, and you just keep it on the tongue. It melts within less than a second, I think, and it gets absorbed from the tongue. So with this, Dr. Abhijit, it's been a great day. We've learned so much about, I think, not all about anemia and not only about medication counseling. I think we have learned from you about why we have become doctors. That is what you've told us. That is a subliminal message, and it is a very nice, a very pleasant, a very optimistic message to have. Honestly, it's been a very re-energizing, a very rejuvenating kind of a nine talks today, and I'm sure everyone will join me in acknowledging and appreciating that. So thank you, Dr. Abhijit, once again for being with us. Dr. Abhijit is a physician from Dhanbad in Jharkhand, and I request Team FDC to give the vote of thanks for today's program.
Thank you, sir. Thank you so much.
Today we got Dr. Abhijit because Jharkhand is one state where the incidence of anemia is the highest, and we wanted to get on doctor from the grassroots who's practicing at the rural setup as well as in the government setup. So we wanted to have someone who share actual what's happening in India when we are talking about for last 16 episodes, what is the approach in terms of treating the anemia. With this, we come to the end of 16 weeks RN talks with Dr. Sanjay Kalra. We had diverse topics. We had diverse doctors coming from diverse geography. I hope we have lived up to the expectations of the series we thought with the objective. And next week onwards, we will come back to our original journey, which is 52 weeks diabetes essential year 2 with Dr. Sanjay Kalra every night, Sunday, 9 p.m. show. I sincerely thank Dr. Abhijit Kumar being a part of this journey and always be obliged with the presence of Dr. Sanjay Kalra. Thank you, good night, and Jai Hind.
Jai
Thank you.
Hind.